We need to be in tune, in perfect health. As if somebody is still here, stand up and good, good, a little bit shake up, shake up, shake up. This is mostly important what can be. Good, 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 good. You understand what I understood? First, if somebody wants to know about me, what I am doing, who I am, is please write only my name, Dr. Tatz, T like Tom, A-T-Z. And you see YouTube, and you see I wrote a lot of articles, and I think few articles about Scenar I wrote, as I don't going to talk what is written in internet and so on. So I only want really, I want a little bit to have experience with your body. Why, for me, you have picture, I'm physical therapist. As for me, everything's supposed to move. For me, is if I do laser therapy, is laser moving the body. If I do ultrasound, the sound moving the body. And if I do scanner, no question, the vibrations moving the body. But I believe, you see, I'm talking with the hands. I mostly believe with the hands to move the body. Why? This is the genius who make the scanner, the couple genius we know in the 80s in Russia did the scanner. Really very talented people. But God gave for us hands. No one animal has hands. We have the hands. And I think with the hands, we can do what no one machine can do. I'm sorry, scanner people. But I'm telling you, if I have fire in my clinic and I'm running, I'm first what I'm going to grab with me, the scanner. Everything, ultrasound, electrical stimulation, shortwave magnetic therapy machine I have who costs $45,000 machine I'm going to leave. But scanner I take. The scanner who I bought in Russia 15 years ago for $900. But it's worth to pay, I think, a little bit more today. This was 15 years ago. This is really, I'm using scanner every day. I working 12 hours, 7-8 hours I holding scanner in my hands. But I never don't holding the scanner in the body. I always moving the body. And I am doing scanner. And I see somebody agree with me. And this is the worst scenario, I think, for even, you know, Freud, when was young and energetic, his treatment was not to sit and to talk. His treatment was physical treatment. He did physical therapy for psychiatric problems. Why Freud knew, was smart enough, understood, as first we need to move the body. How to move the other stuff? I think we can move with hands, we can move with scanner, we can move with light. The laser moving the body, moving the body tissue. This means this is important. We don't have choice. But what we can feel with the hands, I'm sorry, scanner cannot feel. But the hand's supposed to be practice. But really, I want we little bit now, I want to show always how I starting the treatment with people. I think first, before I trying to do any treatment, I always said, let's we move a little bit. This is most important. People mostly complaining about when I get from the chair, I have problem. When in the morning I get from the bed. I said, well, with a scanner or some other miracle pill. We need to teach the basic things, how to get up from the bed, how to get up from the chair, how to walk. Are you looking how people walking? Scanner is very good, no question. Magnet is very good, but maybe we need to teach how to walk, how we did walking when we babies. We don't need to babies children to sit, to learn how to sit, how to walk. This is natural. But today we live in an environment, even here, I'm sorry, the people not here who invite me, but to stay in a room like this all day, I'm sorry. This is, I think, some kind of punishment. You agree with me? As this means everything what happened today in our society, in the beautiful 21st century, this everything gains the nature, and this everything affecting to our bodies. Any stimulation is good. Some is better. When I saw this about the TNS, yeah, this is bullshit. This is nonsense. I was checking this stuff 40 years ago. I told immediately, transcontinuous electron nerve stimulation. This is nonsense. And you see what happened, why somebody makes money from this stuff. This is why everybody, every doctor knows insurance even covers the machine you can buy. It's not expensive today, cost, but I remember when she was cost $1,000. And scanner, this is comparison, God mine, how do you know studies to prove comparison? This is day and night, the results, what we can get with scanner, with the TENS. This is TENS, this is placebo effect, only placebo effect. What we cannot tell about scanner. We cannot tell about scanner, but no question, I'm sorry again, I tell you, and Tamara knows very good, I tell, yes, scanner, but not only scanner. And I, thanks God, like physical therapist, I can use everything what I want. I can use everything what I want, any machine. And if I see the scanner is working, why not? And I, again, tell this is, I didn't know. I'm sure there exist some people who putting even electrodes on the knee. I put electrodes on the knee. At the same time, I can work on the sacrum. Why? We know very good if somebody has problems in the knee, with lower back, some problems. We need to do something. If we take care only on the knee, this doesn't work. But the same with the scanner. We don't going directly to the point. We're working on the spine. That's what we saw. We're working on the spine. And later we're going slowly to the complaint part of the body. As no question, the scanner is supposed to be, when I traveling personally, I always take with me scanner. I have at home scanner, at work I have 2 scanners. I have even a scanner who I bought for $100. Today no price, $100 for scanner. I was, this was in 88, 89 in Russia. I was bought like 10 scanners, and I was, for my patient, I was, okay, take for a week. Everybody, but from the 10 scanners what I bought later left for me only 1. Nobody returned back. It's okay, I hope people using the scanner. As no question, the scanner in physical therapy supposed to be number 1. But I know the insurance don't paying. But I don't dealing with the insurance, I don't dealing with the insurance. I don't dealing with medical doctors. I deal with the patient. And if I see it for patient is good, I do. And this is okay. This is kosher for me to do what I believe and I have experience. This is good. This is not against the law. Even I was using the scanner, Tamara knows, before FDA approval, SHM approval. And this is legal. There's no problem. If I telling I have experience with this machine I can use. You know, somebody crazy body can tell me to quart, doesn't matter what I'm using, ultrasound I'm using or scanner. This has happened. But legally, I like physical therapists. I can use this. I don't need prescription. I don't need FDA approval. This is why some physical therapists asking, but insurance don't cover. Guru, no, if you're working for insurance, okay, work for insurance. I don't work for insurance. I work for patient. I tell to patient. Now when patient calling me, I telling appointment. Guru, no. First, if you really believe I can help you. What you mean? Look my website. Read, Google me, like I told you to Google me. And if after what you see and you hear, this guy can help me, make appointment. We together, if you believe me and I see you really, you want to get better, as we together, we can beat the tendinitis, schmendinitis, the migraines, doesn't matter how we call the stuff. Why first we need to believe as what we're doing, this is really, really can work. As you see, I am really think a scanner supposed to be in every physical therapy office, and from personally, I know not many, but I personally know about 100 physical therapists, and I know only one other, by the way, my neighbor, who has bought the scanner only maybe 2 months ago and asked me what you think. If you bought it, this means sure you believe this is good.
I have in Nova Scotia almost 25.
25. Not in Manhattan, not in New York City.
Nova
No.
Scotia.
No, maybe, but not in Manhattan. I know a little bit more about Manhattan. Okay, as I know everybody is anxious to go to dinner or some dance party. As if you have some questions, I try to answer. Please.
What kind of techniques, or when you decide to use a scanner on one patient and laser or other patients?
Yeah, but this is like, I tell this like physician. Why physician, good physician, decide to use one medicine or other medicine for anti-inflammatory, many anti-inflammatory medicine. This is why we study, and this is why we have experience. And we see the patient, we smell the patient, and we hear the patient, and we make decision. But no question, this is the toughest decision to make what technique, what modality I'm going to use. Some people hate to feel some kind of electrical vibrations. This is why always before I use on the patient, I show on my hands, you see, I do what I'm doing, I'm going to do you, and I feel very, very light vibrations, very, very light. I'm not allowed for people to feel strong vibrations. Why I call sometimes I do homeopathic physical therapy. Very, very gentle. In this, like, you know, some physical therapists, no physical therapist? You're physical therapist? No. Okay. Physical therapist is cranial work. This is very, very gentle work. Very, very gentle work. And for some people, this makes miracle. But the same for some people makes adjustment miracle working. How to know? We need to know. I need to know when to do very gentle and when stronger. And even scanner, sometime I can see I need to do stronger. But always I telling. Tell me when you feel too strong. Always I am telling. First I'm showing how this feels, and later I am telling. Answer? Good. Well, you have some questions, sure. You're looking like
No, I don't.
No.
Just do it.
What you doing? What is?
Scanner therapies?
Only scanner therapy.
Yeah.
And you using only scan, or you using a lot of stuff, electrodes?
All electrodes, what you can imagine.
Yeah. The electrodes, no question. I tell you true. I use electrodes when I'm very, very busy, and after I work, and I have smell the patient wants to stay other 15 minutes as I am putting the electrodes. This means I never don't do only electrodes. Only why with the hand when I do, I really I feel what happened with the hand when I'm moving. And always when I do, always I never scanner. I never don't. I never do, you have scanner. I never. Thank you. I never. Oh, you have fancy. Yeah. I never don't do like this. I want to feel the reaction of the patient, number one. Number two example, if I work on the spine, I always, one other hand, I holding the neck. In the same time, I doing the cranial I can do. And here I do the scanning. As always, I trying like to do the combination. Like you know, today even in physical therapy, we have ultrasound together with electrical vibration, spatial machine. Yeah. As always, I think if we can combine like them, physician gives them not one medicine, two medicines together. As the same in the to do with the scanner, I think this is very, very important. What I do with the other hand. Or with the other hand, I do mobilization. Yeah, I have fingers, I do mobilization, and here I do scanner. Even here, I do mobilization. I do more in the same, but in my fingers, I work with scanner. You doing this? Yeah. The same time I holding the hand. Yeah, the scanner is very, very smart, feels, but what we can feel with hand is different thing. It means always I'm going together, and always I put scanner and I do with both hands. I'm working. But I think, but I never don't do this. Never, always one hand on the neck, and any part of the body. Yeah, I think.
Do you use diagnostic mode to?
No, you know, Tamara not here. Yeah. Rivenko was in my office 4 years ago, and no Rivenko, you know, is a scanner. Doesn't exist nothing in the world. And I get three patients who I know. Not easy patients, but not some kind of terrible patients. And Rivenko did the treatment and did the classical stuff. And later I talked with the patient. No, from these three patients, nobody told I want to get this kind of treatment. Everybody told me, let's we go this what you did before. I'm sorry, the same I did with acupuncture. I have licensed acupuncturists who came, I told him, I did note in my office, free, next week every my patient can get free acupuncture from licensed acupuncturist Valery Kovalenko. 25 patients signed. From the 25 patients, nobody continue acupuncture. Valery, good acupuncturist. Very good. I know why Valery was a Russian trained physician, very good manual therapist, and get licensed acupuncture study in New York. Nobody from the 25 people told, next time I want to continue acupuncture. Everybody told, let's we do the old way. I tell this doesn't mean Valery later, some patient didn't continue after manual work to put the needles and to rest for 15, 20 minutes. But I believe I'm 45 years working with the bodies. And it's very important to have the studies to prove the FDA, they either these crooks. We need the proof, I know. But I have enough my own experience. And I have enough friends who I believe. This is how I learned about scanner. This was 20 more years ago. Some woman came. I remember the woman, 40 plus, and she, long story, nothing didn't help you. She did list what she did.
My question, I like that, but my question, if we need to replicate your experience, how can we do that?
Replicate?
Your experience.
How I do? This is what I'm telling. I telling you how I do with the hands, how I'm combining. This is my experience. This is very important. As this woman said, I did some woman did for me some kind of machine. What is machine? But this machine was helpful for me. The woman, On this machine. No, wait, she did for me like 20 minutes massage, and later she did some kind of machine. What kind of machine? You have the telephone of this woman? She was, yeah, I have. This woman was in Haifa, Israel. I called to this woman. I told who I am. Like, what the machine? She told scanner. What is scanner? I never even heard. And later, this is how I came to Yaakov, who was head of the scanner in Taganrog, blah, blah, you understood me? This means I am everything what I learned from my friends, from people who I believe. But I know important to have the studies, but not for me. For me, important what my patient reporting and what my colleagues with who I know telling me. Answer?
Yeah, a little bit.
Yeah, please.
How can you transfer your expertise to someone else?
Very good question. Everybody tell, this is good. No, we don't need to do something new to discover. It's a good expression. Ein chadash metachat l'shamayim. 1,000 years ago in China, who became acupuncturist? You going, you young boy, 19 years old, you working for 10 years with old guy. In 10 years, you become acupuncturist or Chinese medicine doctor. Very, very simple. You need to be in the action. And I don't have many students. I have about 10, 12 students who spend with me a couple years. And now the guys, I tell the guys, a better comparison with me. One guy was like 3 years ago, was big article even in New York Times, how he's successful with working, doing mostly the, by the way, not educated, even though.
But they are not using Scenar?
He's using, you know, scanner, this is brand name, but exists other very similar like scanners. I don't want to go into what is better. I use scanner and something else, but this guy was using other, but he's using the other cost, you know. Yeah, this I answer this. We need to only, how we learning even today, what is therapy? It's like to play, I told the piano, any instrument. You practice. You have lesson once a week, and later you practice. And this is how you're learning. Only how you can learn to even to take the scanner. See how some people, even to take the scanner, this is only from if you working, practicing it. You're doing on yourself, you're doing on who you hate, and you're doing who you like. And like this, you're learning. Yes, you're right. No, somebody still have questions. Tamara going to be unhappy. I didn't talk too much. No questions. I invite you for a beer. No, not for beer. What do you have to do for dinner? But very, very, by the way, I see there's no one physical therapist here, Cam. You see, and this is the truth. This is physical therapy. This is physical therapy. No one physical therapist. And just everything. Why? Yes.
I have a question in that case. Can you show, I can be a volunteer. Can you show us a technique that you do with Scenar, with, let's say, the neck?
Yeah.
Would it be useful for you?
Okay. You bought it?
I will.
Good.
So I'll be your volunteer.
Yeah, a little bit sex I understood.
Because we'll see how you work.
Yeah. Please.
Come together all
Yeah,
together.
please come. This is working. How you open?
Yes, it's working.
Working, yeah. And this is the
Plus
first.
is more energy.
Yeah.
Minus is less energy.
Yeah, this is very new. This is why I'm asking. This is very new. This is like this. This is this Cadillac.
No, it's really old.
This old? No.
Yes, I worked already.
Yeah. A couple years, but this is not from 50. They take this, please. I need you upper body.
To be there?
Yes.
Yeah, obviously.
Walk around, please. A second. camera, sexy back. Okay, good. Always try to stay a little bit something like this, okay? A little bit move, 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 move. Move, move, move. Left, right, left, right, left, right. Yeah, good. Left, right. Very good, very good. Okay, good. Now walk around, sit down here. Come to me. Come, come, come. Yeah, come, come. Oh, this is, I think, this is okay, supposed to be now. This was for this reason. Yeah. Yes, the hotel very rich can pay later for you. Okay, good. Yeah, no question. I see the right side much more tight, yes? No?
I have a stainless steel plate here
Ah, you
with
have
7
here.
screw.
Uh-huh.
But it's fine, it's fine.
Oh, fine.
It's not painful.
Uh-huh. Okay. Yeah, you see, but the mobility is here better comparison with this. Yeah. Okay, let's lean down on the left side, please. Yeah, like this, the pillow. Yeah, good, good. Yeah, okay. If something not comfortable, you tell.
That's fine.
Good. Okay, scanning. Thank you. If something not comfortable, you tell me, okay? Okay, you see, first I try in my hand. And if I see is really relaxed, I starting to do. If it's not relaxed, I never been going to do nothing, yeah?
You adjust bar level for me, or?
You feel?
Yeah, I feel a bit, yeah.
Yeah, okay, a little bit. You need to feel a little bit something, nothing more. Yeah, we have music, you see. By the way, in my office always I have music. Now we make music. And now you know if I feel here like a little bit sticky, I'm staying here a little bit more. And even now I trying to see my left arm, I pulling, pushing, and this going down. You feel, You feel it good?
Yeah, yeah.
Good. This is how I save a lot of time if I'm working like this. And now even I tell a little bit rock together, a little bit rock the body, rock a little bit the body. Try to, see? Now I do three things. Is doing a little bit exercise, is rocking the body. Yeah, the rocking the body is means is using some ligaments around the spine. This is the muscles around the spine. See, rocking. Is right hand. See, I'm doing the scanning. Yeah, and the left hand makes traction. See, and you keep rocking, and you keep rocking. Yeah, easy, 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 easy rocking. Yeah, and like this I'm working. Now I make the other program what I like. Yeah, now we tell you you feel. You feel?
Yeah.
Yeah?
Yes?
Okay. You see, now I hear no question. I feel here in my left arm here, lot of tension. You see, I don't familiar with the scanner. You feel? You
Yes,
feel?
somewhere? Not much, no.
No? You feel or nothing you don't feel?
Not much.
You need to increase it a little bit. Push plus.
It's on 55.
Okay.
Yeah?
Yeah.
and only after I'm going higher. And here, you see, always I am, this is my left arm, yeah, you see?
So are going with the muscle direction?
Before that?
You are going with the muscle direction?
No, no, I don't think about the muscle direction. I don't think. I think how the sticky, yeah? In the direction what more sticky, I try to move more to the direction.
You're following the stickiness.
Yeah, yeah. Okay, now you see I'm working with my both hands, yeah, in the scanner. You see, I move with my right arm, I move my left arm in scanner. You're getting 3 sessions for 1.
You are not touching the electrode very well.
Yeah,
The electrodes are not touching very well.
you see this is even too close. How?
What?
Shut up. Oh, see here. And then, okay. You see, this is different. Okay. As you think, yeah?
Yeah.
Very, very simple, nothing not fancy. Sit up, please. Drop the legs. And for me, very, very important, the posture. The posture. Keep moving. Yeah. Keep moving. Yeah. Keep moving. You okay? Yeah, keep moving. Yeah. This is most important exercise. This is most important. Keep moving. You see you not like. Keep moving. Don't stop. Keep move. I don't stop. You see, this is mostly natural movement. It is very hard for him to move. This is mostly simple movement to move. Yeah. Okay, now come here, please. Come. It's number 1 for me, the posture. And move. Watch, and you moving. You don't
Move your shoulder.
Yeah, shoulder. See, what sports you did?
A lot.
A lot of sports. You see, this is the worst scenario. Sports, yoga, Pilates, destroying everything what we have not natural. I'm right, yeah? Everything is wrong, but we want to be like everybody who makes the billions. Yeah. Keep moving. See, it's usual, by the way, usual for average Joe is not average, it's very good shape. Average Joe, when they keep doing, people don't stopping. Keep moving. It's very natural, but people who do the sports or the ballet are very, very hard. Why like always 2, 1, 2, 1, 2, 1. What is this natural? What? Understand? This is why scanner supposed to be for every professional athlete package. Okay, good. No, I hope you have the
So, what did we get? What about his movement? Is it better now? Could you show us?
To move the arm if you feel the different arm.
I think it's more symmetrical.
I tell always something supposed to happen after treatment. If not happen, this means I need to do something else. The patient supposed to feel something happen. And sometimes even a little bit more reaction, even pain, it's okay. Sometimes whatever. But I hate when people tell, God, mine, miracle. This is, I'm in big trouble. Then coming the patient 2 days later, I am perfect. Oh, bro. I know this is psychological problem, not physical problem. And I'm very, very weak in this kind of issue, the psychological. That's why I know very good. In next to treatment goes, why I cannot move my neck. But if patient comes and says, better, good, or a little bit more pain, it's okay, it's okay, a little bit is okay. And it's supposed to be some dynamics. You need to feel something, but no miracles, no miracles.
Thank you.
Okay?